Welcome to Palliative Care Explained, a channel aimed at answering your questions about palliative care. My name is Dr. Jonathan Wong, and I'm a palliative care doctor based out of Winnipeg, Canada. Here are two questions I frequently get asked by patients and families. What should I expect to see from my body when I am dying? What are some of the physical signs that may mean death is near? In this video, I will be answering these questions by discussing what the natural dying process looks like. Let's talk about it. Please see the first introductory video of this channel for information about me, my declaration that I do not have any conflicts of interest or financial sponsors, and the medical legal disclaimer statement. In this video, I want to focus on the signs we often see when patients only have hours to a small number of days to live. Healthcare professionals often call this the final phase, or the actively dying phase. What we see leading up to this final phase can be highly variable, and as such, is not very predictive in terms of estimating a prognosis. But to provide a broad overview, many patients, if not most, have experienced decreasing energy levels, the need to rest or sleep more, and as a result, being able to do less and less. Their appetites also become smaller and smaller. It is common to witness changes in taste perception, where tasty foods once enjoyed are now thought to be less so. Unintentional weight loss is also commonly seen, but the amount can be very variable. Some patients also have changes in their thinking and features of delirium, and this includes fluctuating levels of confusion, being inattentive, easily distractible, or more disorganized in their thinking. Let's now focus on what we commonly see in the final hours of days of life. Now, these observations can be seen across many different illnesses, both cancer as well as end-stage organ illnesses. These signs are much more predictive that death is near. In general, patients are now often fully bedbound and require full care for activities of daily living. Patients also commonly appear very sleepy or somnolent and spend most of the day with their eyes closed. As a result of this sleepiness, intake of food or water is very limited. Now, despite best efforts from family members and healthcare professionals, what we have found is that in this phase, there is little one can do to make patients less sleepy or to perk up. There are many physical signs that reflect the body slowing down and the internal organs shutting down. One may see a few of these, or a combination of them. Let's talk about the skin changes first. When we are healthy, our skin should be warm and consistent in temperature, color, and appearance. In this stage of dying, the surface of the skin can start to have a mottled appearance. The skin may also have color changes, with areas that appear more blue or purple. The extremities, especially the hands and feet, can feel cool or cold to the touch. This is usually the result of reduced blood flow to the surface of the skin. Let's now talk about the heart and the cardiovascular system. When we are healthy, our blood pressures and heart rates typically operate within a very narrow set range. At end of life, however, the blood pressure may become very erratic with highs and lows, and this can be very alarming to family members. More commonly though, blood pressures become very low and patients may feel lightheaded or dizzy. The heart rate may also become more erratic, both fast and slow, and sometimes may also appear to be irregular or inconsistent. This is happening as a result of the cardiovascular system shutting down. But at the same time, it is also trying to compensate for all the other organs around it also shutting down. And this is one of the reasons why you see these erratic ups and downs. Let's now talk about the lungs and the respiratory system. When we are healthy, our breathing rates and patterns should be steady and regular, where the chest rises and falls evenly. At end of life, however, we begin to see different respiratory patterns, and these can appear more erratic and inconsistent. This is due to chemical imbalances and changes in carbon dioxide levels in the bloodstream. What we may see then is a series of rapid breaths, followed by periods of slower breaths. We may also observe what we call apneas, or periods where the breathing stops for a few seconds, and then the rapid pattern comes back. This process is not to be confused with sleep apnea in an otherwise healthy person. That's a completely different topic. Let's now talk about the kidneys. When we are healthy, the kidneys function as a very sophisticated filter for our blood. Waste products are eliminated in the form of urine. As a product of reduced intake, though, a lower blood pressure, and other systems slowing down, the kidneys themselves begin to shut down too. We can see this in a few different ways. Firstly, the urine output becomes smaller in quantity, and the color of the urine becomes darker and more concentrated in appearance. The odor of the urine may also become more pronounced. As the kidneys are less able to rid the body of waste chemicals, that waste remains within the body, and this commonly leads to increased sleepiness and confusion. This is one of the reasons why patients at end of life are less rousable. And when they are awake, they may appear to be more confused and more delirious. Sometimes, what we see is increased agitation and combativeness, potentially a change in personality. As this delirium process worsens, it is possible for patients in this phase of dying to experience hallucinations, vivid dreams, or appear to be re-experiencing previous life events. These changes in cognition are often very difficult for family members to witness, but I want to assure you that this is a natural process and is commonly seen. Let's now talk about the potential presence of airway sounds or airway noises. Historically, healthcare professionals have called this the death rattle. Now, I will admit that this is not a very nice name for it. But what this is describing is a gurgling type sound caused by the presence of secretions or mucus in the back of the mouth or higher up in the airway that vibrate and rattle during inhalation and exhalation. It sounds very similar to blowing bubbles in your milk through a straw. When we are healthy, mucus in the back of the throat is easily cleared out by coughing. At end of life, however, full body weakness impairs the ability to clear these secretions, and as a result, they remain and vibrate. Imminent death, as portrayed in the movies and on television, is rarely how it actually happens. It is not very common for patients to be speaking coherently, then close their eyes, have their head turned sideways, as an indicator of death. In the final moments before death, the skin can take on a more pale gray or ashen appearance. Certain parts of the body may appear more sunken in. Breathing and the rise and fall of the chest may become more shallow, and the breathing rate becomes slower. We may also see longer and more frequent apneic episodes in this phase as well. There will be a point where the blood pressure becomes so low that it can no longer support what remains of bodily function. And at that point, the heart will stop beating. Breathing will also stop. There may be a few reflex-type gasps of air at the very end. The pupils may then dilate or become larger, as it no longer has control to constrict. Some patients' mouths remain open in this final phase. Similarly, some patients' eyes may remain partially open as they pass away. With no heartbeat or respirations or neurological response, death has occurred. I hope this video gives you a better understanding of some of the signs of when death is near. Unfortunately, The science of dying is not a precise science. Everybody's path is slightly different, but hopefully this video gives an overview of what is commonly seen. Thank you very much for watching this video. If you have further questions, please contact the medical team most familiar with your unique situation.